Hello everyone, welcome back again to my channel, that is Obstetrics and Gynaecology Simplified. Today we will discuss about a very important topic yet again, that is the partograph. It is very important clinically. We have to know how to know the progress of the labor. This is a very objective method. Okay, so the partograph, it is a graphical representation of the labor progress so that we can know that what is normal labor, what is abnormal labor, and how to intervene when any abnormality of the labor is detected, and also the shift are changing. So this graphical representation that will help the next set of students to understand that what has happened to the woman in the last couple of hours. Okay, so that it is a very informative and graphical representation of the labor progression so that we can intervene early. So let's start with the partograph. In the first video, I'll just divide the partograph into two parts. In the first video, the normal partograph, how it was evolved, when it was started, everything in the details I will let you know, and also the components of the partograph I'll be telling. And in the next video, I'll be discussing about the abnormalities of the labor, and in the Viva questions also you have been asked a lot of times. The different partographs will be given on obstructed labor, maybe prolonged labor, or arrest of descent, arrest of dilatation, protracted labor. All these various partographs will be given. So you have to identify, you have to tell the management. Okay, so in that the clinical aspects I'll be covering in the next part. Here we will learn about the basics of the partograph. Okay, so let's start. Coming to the partograph definition. Composite, it is a composite graphical representation of record of the key data. That is both maternal and fetal components during the active phase of labor. During the active phase of labor. Initially, when it was developed, okay, when the partograph, it was first introduced by the Friedman. So previously it was called as Friedman curve. First it was introduced as Friedman curve. So what the partograph, it serves as early indication or serves as early warning system. In 1954, first the Friedman, okay, Friedman introduced Friedman curve. So what were the components then? So he started as partograph using as a research tool. Okay, so first he introduced the partograph or a curve, okay, that denotes a research tool. So what is the full name? Dr. Emanuel Friedman. Where he did the research in Columbia University. Okay, so the study included 500 women. Okay, it included 500 women. In the y-axis it was cervical dilatation versus time. Okay, so it included 500 women. So what he did, in the Columbia University, what he did, he took 500 women in labor and plotted the cervical dilatation in progression to time and used as a research tool. So what the results came? The results came as the S-shaped curve. Okay, initially it came as a S-shaped curve, that is sigmoidal curve. Okay, then he divided the stages into divided into okay, means the labor. Okay, labor was divided into first latent phase and then active phase. In latent phase, there was slow dilatation, and in active phase, there was rapid dilatation. Then again, he divided into acceleration phase. The active phase he divided into acceleration phase, then phase of maximum slope, and then deceleration phase. So I will show you the curve. See here, in 1954, first the Friedman he gave the progress of the labor in normal progress of labor. First he did say this is the cervical dilatation in the y-axis, then versus time in the x-axis. So this is in centimeter, this is in hours. So he divided into latent phase and active phase. Okay, so latent phase there was slow progress of labor, then in the active phase there was rapid progress of labor, and again he divided the active phase into acceleration phase, phase of maximum slope. Okay, this is the phase of maximum slope and this is the phase of deceleration, and then came the next stage, that is the second stage. So Friedman gave first the cervical dilatation versus time, divided into latent phase and active phase. Latent phase it was slow and active phase it was rapid. Okay, again he divided active phase into acceleration, phase of maximum slope and deceleration. So here first Friedman gave it as a research tool. First he did in 500 women. Next what happened, came the modification. Okay, so in 1972 there came another modification. In 1972, Philpott and Cassell, okay, they did the clinical management. They used this as a clinical management. Okay, that means they used in clinical, for the clinical intervention in the woman undergoing the labor progress. Okay, so which Philpott and Ian Cassell. In Rhodesia for he did it for the midwives. Okay, for the midwives, so that they can in the peripheral, in the primary referral center, what we do, the midwives they may not be knowing the actual what is normal labor, what is abnormal labor, they may not be knowing the warning signs. So the Philpott and Cassell, what they did a modification, they used it is at a it as a clinical tool. Okay, clinical management tool in the peripheral center, so that the midwives, if it crosses, and they introduced alert line and action line. Okay, they introduced alert line and action line, and when the it crossed the alert line, the midwives should know that when to refer. Okay, so they used as it as a emergency referral system. So as in the periphery, all the abnormal labor could not be managed, so the midwives have to refer. The normal labor they can do the normal delivery, normal vaginal delivery, but in some centers, so for the cesarean section also, there is no availability of the OT system or the anesthesia team, and also the surgeons, and also the ICU may not be available, so they have to refer. So the Partograph, if any abnormal labor, they should know, and they should know when to refer. So it was used as a clinical management tool for the midwives for the referral. Okay, so what they did, they introduced the alert line and action line. alert line and action line. Okay, so I'll tell you in details that what is alert line, what is action line in the partograph. I'll tell you. Then in the action line, it is used to identify the slow progress of the labor. Identify slow progress of labor, and it is the curve is 1 centimeter per hour. Okay, and then the action line, it is 4 hours. This is the alert line. The action line, it is 4 hour lateral. Okay, to the right, 4 hour to the right of alert line. And then patient may be transferred it if it crosses the action line to tertiary care. To tertiary care if it crosses action line. Okay, then there came in 1990 there came WHO Partograph. Okay, that was the standard. Okay, that was the standard partograph, that is the WHO Partograph. There came WHO Partograph. In 1990. Okay, so it did 18,000. The trial was consisting of 18,000 Southeast Asian women. And what was the finding? That partograph reduced duration of labor, rate of augmentation of labor, rate of augmented labor, rate of postpartum infection, that is sepsis also, it was reduced. Then rate of emergency cesarean section was also reduced. Then in 1994 the WHO Partograph was launched. Okay, in 1994 the WHO Partograph was launched. Okay, then it became a global gold standard for monitoring of labor in 1994. Monitoring of labor. So how did the evolution of the WHO Partograph happen? WHO models first in 1994, the WHO composite partograph was introduced. Okay, in 1994 first. And this is the evolution. Okay, first how? This is the evolution of WHO model. Evolution of WHO models. In 1994, first it came WHO composite partograph. It included latent phase, that was from 0 to 3 centimeter. Here in WHO composite partograph, when it came in 1994, the latent phase was up to 0 to 3 centimeter. Then the active phase, it was started after 3 centimeter. But difficulty to determine exactly, okay, when the latent phase was started, that led to premature interventions. Okay, determine the exactly when the latent phase was started, leading to premature interventions. So later on the latent phase was removed. Okay, so the WHO partograph, the modified WHO partograph, that included only the active phase. So latent phase was removed because we did the early interventions, premature interventions was done. Then in 2000 there came modified WHO partograph. Came modified WHO partograph. Here the latent phase was removed. Here the latent phase was removed. And active phase started from 4 centimeter. Okay, so active phase, it was started from 4 centimeter and the latent phase was removed. So now we will discuss about the alert line and action line. You see, I will be showing you here now the image of the partograph. This one is the Friedman curve. I've told you this is the partograph, WHO partograph. So what are the components? I'll show you. First, in the first part, in the top part, there is name. Okay, we'll write the name of the patient, then the gravida, okay, then parity, then the hospital number, then the date of admissions, the time of admission, and if the membranes are ruptured and how many hours ago it was ruptured. Okay, so this is the, what are the components here? First, see, I've told you, I'll tell you about the action line and alert line. So this is the alert line, this is the action line. Okay, so see here, this is the alert line, this is the action line. So previously it included the latent phase also. Then then the action alert line was started at 1 centimeter per hour. See, this is the partograph, the small box. See, this is the small box. The small box, it is 30 minutes. And the large box, see, this is the large box. The large one is 1 hour. So the small box in the partograph, if anyone asks you that the small box, what is the time of the small box, that is the 30 minutes. And FHR, okay, that is plotted every 30 minutes. So we have to see the fetal heart rate every 30 minutes. Then this is the fetal heart rate. Then this here comes the Liker. We have to write C. If we write C, that means the Liker is clear. If we write I, that means the membrane is intact. Okay, it has not ruptured, so we do not know the Liker, the membrane is intact. If we write M, that means it is meconium stained. If we write B, that means it is blood stained. Okay, then we have to write the molding here. If there is only grade 1 molding, we'll write single plus. If double plus, if the molding is of grade 2, then we'll write double plus. If 3, then 3 plus. Okay, in severe molding. Then here next we will plot the cervical dilatation and descent of the head. Okay, and here we will write the time. when first it is plotted, and then when we will write the contractions. Okay, we will see in how much time. Okay, here contractions per 10 minutes we will see. If it is mild, then we will put the dots. If it is moderate, then we will draw stripes, and then if it is more than 45 seconds, then we will do as solid, the solid marking. That means the contractions are lasting for more than 45 seconds. Okay, then here we will write about the interventions that we are doing, giving any IV fluids, or we are doing augmentation, that is oxytocin is provided or not. Okay, here drugs and IV fluids will mention, and then BP pulse and temperature we will mention, and also here urine protein, acetone and volume. In blood pressure and pulse we will measure every 4 hourly. Okay, temperature also every 4 hourly we will measure. And so these are the parts of the partograph. Okay, then see here one partograph is plotted. So I have written Mrs. B, then gravida 1, this is primary, then hospital number we have written, time of admission we have written. Okay, then date of admission we have written, then FHRC, it is between 120 to 130. Okay, every 30 minutes it is plotted. So this is 30 minutes, so every 30 minutes it is plotted. Okay, 30 minutes here, 30 minutes here, every 30 minutes it is plotted. Then Liker, it is clear, then clear, and then clear. Okay, then molding also we are writing here. Then cervical dilatation, see here at 5, when was the admission? Admission was 5 am late. So at 5 am the cervical dilatation, it is marked as 2 centimeter. Okay, then descent, it is marked as 0, here it is marked as cross. Okay, if the dilatation is marked as cross and descent as 0, it is denoted as 0. Then here dilatation was 2 centimeter, and then gradually the dilatation was after 4 hours, then the dilatation was 5 centimeter. So this is how you mark the dilatation. And what is the descent? Descent, see here it was at see this one in 5 p.m. it was high up, then at 9 o'clock, then here this is the descent. Okay, it came to -3 station, and then -2, -1, and this is the 0 station. See here the contractions, first initially it was moderate contractions lasting for, these are the contractions per 10 minutes. Okay, 3 contractions here, and this one is 4 contraction but moderate, here lasting for more than 45 seconds. Okay, here also solid. Okay, that means the contractions are very good. Then coming to the oxytocin, or drugs given or not will mention, and then BP and pulse we are mentioning here, and also the temperature, that is written 4 hourly. Okay, then so let's write about the action line and alert line. What is action line? Alert line and action line. First alert line. So alert line and action line, both these are marked after the onset of the active phase. Okay, so alert line, it is a diagonal line. It is a diagonal line starting from onset of active phase, that is from 4 centimeter. Rate is 1 centimeter per hour, and the curve, it crosses, if the curve crosses to right of the alert line, that means the labor is slow. So slow progress of labor. Then the action line. What is action line? I've told you it is marked 4 hours right to the placed 4 hours right of eyelet line and the curve this line. That means if the curve it reaches this line, then we have to intervene. Immediate intervention should be done fast. We have to do amniotomy. We can do amniotomy. We can give oxytocin infusion, or we can do cesarean section. So these are the interventions we can do if it crosses the action line. Okay, then I've told you about the components. So in short, let's write about the components. First, fetal condition. First FHI every 30 minutes. Then amniotic fluid. Amniotic fluid assessment, that is on every PV examination. So what it can be intact, the membranes can be intact, it can be clear, the liquor can be clear, then can be meconium, or it can be blood stained. Then blood stain. Then about molding. See what are the grades? 3 grades are there. Okay, 1, 2 and 3. Here the bones, the fetal bones. Okay, the molding means the fetal bones, it overlap. Okay, bones first it touches and also easily separated. It can be easily separated, then that is grade 1 molding. If the bones, the fetal bones, skull bones, it overlaps. Okay, here only it opposes. Okay, here only it opposes, but in grade 2 it overlaps and also it can be separated easily. But when it overlaps and cannot be easily separated, then that is grade 3 molding. Here bones overlaps and easily separated. But here bones overlap and cannot be separated. Cannot be separated. Then these are the fetal condition. Okay, this is the fetal condition. Then in the second part we will see the labor progress. Okay, in the middle part of the partograph we see the labor progress by cervical dilatation and descent. Cervical dilatation, that is denoted as X, and cervical dilatation and descent of the head, that is denoted as O. Here it starts at 4 centimeter because at active stage we are starting. Okay, then we will see about the uterine contractions also. That is mild, moderate and severe. If it is lasting for more than 20 seconds, if 20 to 40 seconds. If it is more than 40 seconds, it is denoted as dots. Okay, it is denoted as stripes, and here it is denoted by doing solid. Okay, then coming to the next part, that is the maternal part. In the third things, we will discuss about the maternal condition. So maternal condition, I've told you the BP pulse and also the temperature and urine. So maternal condition, what we see in the Partograph, we write about first we have to know that the mother and the fetus is stable and she is not exhausted. We have to rule out the obstructed labor by the mother condition. So we have to know the maternal condition during the labor, so that we have to know that she is stable, she is not exhausted and not dehydrated. First we see the drugs and fluids, the vitals, that is the pulse and blood pressure, temperature. The pulse we see every 30 minutes, the blood pressure and temperature we see 4 hourly. Okay, you have to remember that. It is asked, okay, in the Viva also you will be asked about the how inside what interval we have to just mention the pulse, at what interval we have to see the blood pressure, okay, and at what interval we have to see the temperature of the mother, when to mention, after how much hours we have to repeat the vitals. Okay, so you have to tell that. In FHR we are seeing every 30 minutes, on that the membranes, the status of the membranes or the Likert status we are seeing on every PV examination, and the vitals, that is the pulse, we are seeing every 30 minutes, whereas the blood pressure and the temperature we are seeing every 4 hourly. Okay, so and also we will see about the urine, volume, protein and acetone, ketone bodies. Okay, ketones. In the next part I will be telling you about the clinical aspects of the Partograph. Okay, so keep learning. Thank you.